The vital victories of School of Medicine pediatric faculty every day are miracles saving the lives of children.
There we go. Oh.
This is the story of Matildas coming into the world. It all starts with understanding the extraordinary medical care provided in the neonatal intensive care unit.
We take care of premature babies and babies who have problems growing in utero. Any baby that is having trouble coming into this world and transitioning.
For Matilda, born with an abnormal heart rhythm, surviving her first minutes and hours involves an extraordinary team of neonatologists and specialists.
We went to the resuscitation, and it was a full resuscitation. For Matilda, she was not breathing on her own. We had to defibrillate or shock. I really lost count of the times we had to do this. At that point, we were wondering when to stop.
Fortunately for Matilda, Dr. Vashist, the pediatric cardiologist on call, is a pediatric electrophysiologist who specializes in heart rhythm issues.
It's a rhythm abnormality of the lower chambers of the heart. The heart has no organized electrical activity, and it's literally quivering. So effectively, there's no blood that is getting pumped into the body. If somebody stays in this rhythm for more than a few seconds or a minute, there's a chance that they can die.
For these newborns, fighting for their lives, research conducted by faculty is vital. Studies look at many factors, including blood used in transfusions.
It's not baby blood. And you and I can be walking around with lead and mercury in our blood, and nobody cares because our brains are not vulnerable or as vulnerable to those heavy metals. But these babies' brains are exquisitely vulnerable to those kind of exposures, lead and mercury. I think we're all control freaks. I mean, we're into all the numbers and everything to make sure that the babies are doing well.
Tell me, how old are you?
3.
Yeah. It's just great when we have a baby coming out of this unit.
And some babies stay forever with the doctors who have saved them.
So Matilda is a patient that I took care of 3 years ago that I will never forget in my life. I think she just had to live, and I'm so glad that she's doing so well. This was one of the most gratifying cases that I've ever worked on.
Every baby is special, but she's a special one that you would never forget.
We just received the most amazing care. We're just so blessed that Matilda is as healthy and happy as she is today.
We're obviously just so thankful for the care that we received. All the way from the second she was born to today. It's just incredible. The dream team across every staff member that we interacted with.
5 for me and 5 for Dr. McLeod. 1, 2, 3, 4. Oh.
Good job.
Thank you.
We're just so thankful. Matilda's such a miracle.
Thank you.
That's it.
Good job.
Good job.
Nicholas is a really active kid. He was on the baseball field 4 times a week, outside playing with his friends. I couldn't get him to stop.
And then all of a sudden it just went downhill, and it went downhill really, really fast. I had to carry him places. He couldn't walk. He wouldn't eat very much. He would shake when he would drink. It was terrible.
It felt like about 5 knives were coming into my head at the same exact time.
Dr. Jack Gladstein, head of the pediatric headache practice, comes to the rescue, immediately figuring out what is causing the intense pain for Nicholas.
I asked his mom and him, "What's your headache like?" He says, "When I lay flat, my headache's all better. But the minute I sit up, it's terrible." And we say, "Show us." So he's fine lying flat, and he sits up, and he goes, ugh, and his face gets pale. He looks like he's ready to throw up. And I said, "All right, lie back down." So the only thing that does that is what we call a spinal headache, because there's not enough spinal fluid. So what happens with low pressure, the spinal fluid basically is a cushion for your brain. And when it's leaking out the bottom, your whole brain kind of sags. And it's very uncomfortable. It's very painful.
To fix the problem, Nicholas requires a blood patch. Dr. Gladstein brings in his colleagues from pediatric anesthesiology.
We're the only clinical division in the hospital that is led and run, and the workforce is all women. And we provide some of the most intensive, excellent care 24/7.
Together, Dr. Anna Savarese and Dr. Kontroff, a School of Medicine graduate, collaborate to do the blood patch.
We access the epidural space, and then another colleague, myself, for this particular case, draws blood. We draw it sterilely and hand it to the other anesthesiologist.
And the idea is that it's filling the space just outside where that flapping opening is, sealing it over with some blood that has platelets and other clotting factors in it, and then it just seals it like a clot, just like a scab on your hand.
They had to give me stuff in my back, like around my spine and stuff. Don't know what it was.
And the beauty is once it was done, he was fixed. It's instant. So within 3 hours, he was happy, he was laughing, he was sitting up in bed, which was great.
Literally, he woke up and said, "My headache is gone."
Nicholas can go back to play baseball. Nicholas can go back to playing soccer and playing outside. Nick can get back to his old self.
It was like really scary. I didn't want to come here. But then Dr. Gladstein just, like my mom said, he just popped in and made me better. And then here I am. I'm feeling a lot better. Thank you so much, Dr. Gladstein. You're the best.
We're still working on things, but we got a procedure done that was hard to get done, and we all worked together throughout the hospital to make it happen. So I guess that's a success.
I want to thank him from the bottom of my heart, because as a parent, that's the most heart-wrenching feeling, is watching your child suffer and then having this amazing doctor come in and say, okay, we can fix them. He solved the puzzle. Forever we'll be grateful for him and thankful.
Dr. Gladstein, I really love you and thank you for helping me.
She was paler than usual. Her extremities were cold to the touch. She felt clammy. I just knew something was wrong.
Following her maternal instinct, Victoria's mom takes her to the pediatric walk-in practice, where she is examined by Dr. Carter, a School of Medicine graduate trained by Dr. Finkelstein.
And for Victoria, that turned out to be an incredibly important thing, that that Dr. Carter was there and recognized the how sick this young lady was.
I don't think any of us are expecting to see somebody present with such a significant illness coming in, literally walking in the door. Part of what we do in general pediatrics is somewhat look for the needle in the haystack, and that's one of the things that we're trained to do.
Evaluation in the ER quickly identifies a life-threatening problem.
It quickly became apparent that she was in heart failure, and that she was advanced. She was in advanced heart failure.
They come into the emergency room, take an x-ray, and their heart is the size of the entire chest x-ray. And it's because the heart, when it fails in a what we call post-viral cardiomyopathy, dilates, it becomes huge.
All options were explored, but it is soon evident to save Victoria, she will need a heart transplant.
So talking to the family about the transplant process and all that it involved, getting her history, working with the other cardiologists in terms of optimizing her existing medical therapy, but ultimately she needed more advanced care.
She said that my daughter's heart just doesn't work anymore, and she needs another one.
There are moments you're fearful, you're afraid of what's happening, and being available to families when they reach those moments.
If I needed more explanation, she would give it to me. She was just really good at gauging where I was through the whole process.
The first time I saw Victoria.
To help Victoria through the frightening days of waiting, Dr. Baker-Smith has her daughter visit.
And she would just sit and they'd call her.
We didn't want to leave each other though when it was time. I really enjoy spending time with you.
We were blessed. She was in the hospital from the end of the first week of July, and she ended up having a transplant on September the 3rd.
The surgery is performed by Dr. Sanjay Kaushal and his team, with anesthesiologists Dr. Savaris and Kontroff.
I tell parents when I meet them, we are going to be connected to your child from the minute they leave the pre-op area into the operating room and back to the ICU until they are securely transferred to another physician. So we never leave their side for that entire period of time.
11 days after surgery, Victoria is at home with a new heart. The journey had started with a pediatrician in a walk-in practice who found a needle in a haystack.
Would it get missed? Absolutely. And I really do think that Dr. Carter deserves a lot of recognition for having been willing and able in that busy walk-in clinic, because it gets very busy, to stop and say, wait a minute, this is different.
She is probably the only patient I have seen in that context that I identified prior to her diagnosis, that's for sure. That's definitely not something that we get to do every day.
For Victoria and her mom, they're forever grateful to the team of doctors and the cardiologist who stayed with them through the journey.
So Dr. Baker Smith is my favorite person in the whole wide world.
And really, the goal is for kids to have a more normal life after transplant. I think that Victoria is a different child now.
It's been a really long road. You know, she just turned 1, and she's been in the hospital for about 10 months.
For Tessa, who celebrated her first birthday several weeks ago, a heart transplant is her only option.
Every day we feel like we're on call, just waiting for the call to come in that there's a heart available.
Whenever a child has advanced heart failure and it looks like heart transplantation is needed, I'm the cardiologist who's asked to come in to speak with the family. Tessa's complicated. Her anatomy made her a challenging transplant candidate. The vessels that take blood to her lungs, they're very small.
With advanced heart failure, Tessa is kept alive while waiting for a heart with a ventricular assist device put in place by Dr. Kaushal.
In her situation, we used a Berlin heart, which is a type of device that pumps blood through her whole body. So she's been living that way for many, many months.
In a 29-year career, I've had 2 patients need this. Tessa's the second, so it's fairly uncommon. We had to anesthetize her for that procedure and several other procedures related to it so that she could have basically this external device functioning as her heart.
With the successful placement of the Berlin heart, Tessa continues her young journey.
Her first birthday was here. It was just February 5th. She's a miracle baby. She's a fighter and she's feisty, which she's needed to be to get through all of this.
Monday morning, I received a call. It was about 5 o'clock in the morning. Living Legacy calls, and they said, we have this heart offer for Tessa. Dr. Kaushal and I work very closely, so I always call him when I get the offer so that we're on the same page.
Tessa's mom is the next to get the news.
When I saw her number on caller ID this morning, I had a good feeling that it was time. And so when I answered, she said, you know, I told you I wouldn't call you unless we had a heart, and we have a heart. So it was pretty emotional.
You got a heart for the baby. A heart for the baby.
She was like, you know, smiling and happy and just very energetic, and it's like she knew that something was happening.
Tessa's heart transplant is scheduled for later in the day, and teams of specialists start to make sure she's ready.
We came to see her to sort of give our blessing, to say she can go and have her surgery. We're not worried that she has an infection right now. There's not an infection that's going to compromise the new heart. And I think she's ready to go.
We've been ready for this for a while.
We're good. We're just going here.
Tessa, bub.
There you are.
I love you. Be brave.
You guys are good? Okay, we're off.
How's she doing today?
It's been 2 weeks since Dr. Griffith and Dr. Kaushal did Tessa's heart transplantation.
She's done well since her heart transplant, and we expect her to recover well in the next few weeks and then eventually go home. Hey, sweetie. Your stats are better now. to get her home. We probably could never have done this operation 5 years ago.
Dr. Koschel he's done things that have never been done before on Tessa. It's amazing. And he's the reason that she's here today.
Treating the most complex of cases, our pediatric faculty make medical miracles possible. Their victories saving the lives of children in Maryland and the nation.